this part of the lesson, we will learn the means of spread. We will learn how diseases spread from one person to another. Now, how do infectious diseases spread? Many microbial agents can commonly move from affected person to someone else in a variety of ways. In other words, they can be communicated, and hence they are called communicable diseases. So what are communicable diseases? Diseases that spread from one person to another are called communicable diseases. These are diseases that spread from one person to another. Examples of communicable diseases is common cold, typhoid, cholera, etc. There are different ways by which these diseases or these microbes move from one person to another. One of them is air. So such disease-causing microbes can spread through air. And in air, this occurs through a little droplets thrown out by an infected person who sneezes or coughs. So when we sneeze or when we cough, we throw out into the air these droplets of water. And in these droplets of water are the virus. So when a healthy person then breathes this air, when this air enters a healthy person, it starts an infection in the healthy person. That is the reason why we are always told to close our mouth with a hanky when we sneeze or we cough. This prevents the water droplets from entering into the air. Someone standing close by can breathe in these droplets and the microbes get a chance to start a new infection. Examples of such diseases spread through air are common cold, pneumonia, and tuberculosis. So a question could be asked, how do airborne diseases spread? For this, you will write whatever I have underlined in green. That will be the answer of how do airborne diseases spread. And here too are examples of some airborne diseases. Common cold, pneumonia, and tuberculosis are some examples. The next part is, we have had experience of sitting near someone suffering from cold and catching it ourselves. Obviously, the more crowded is our living condition, the more likely is that such airborne diseases will spread. So how could you prevent airborne diseases? Is to prevent overcrowded areas, to make sure that the area you live is well ventilated. So if you want to prevent airborne diseases, number one, avoid overcrowded areas. And the second point, live in well ventilated areas. You should live in places that are well ventilated. Ventilated, or we have sunlight coming in. This would prevent airborne diseases. Ventilated areas, well ventilated areas, and areas with a lot of sunlight. We saw in the earlier slide that diseases can spread through air. That's when we cough or sneeze, the water droplets enter into the air. These water droplets carry the virus, and this virus then enters into a healthy person, causing an infection in the healthy person. Now, diseases also can be spread through water, and that's the reason why they always say drink boiled water, because diseases can spread through water. So let us see how diseases spread through water. This occurs if excreta from someone suffering from an infectious gut disease such as cholera gets mixed with the drinking water used by the people living nearby. The cholera-causing microbes will enter a healthy person through the water they drink and cause the disease in them. So these are waterborne diseases when the excreta of the person gets mixed with the drinking water. So the excreta of infected person gets mixed with drinking water, there is a spread of these waterborne diseases. So such diseases are much more likely to spread in the absence of safe supply of drinking water. So how would you prevent waterborne diseases? Waterborne diseases are prevented by using safe boiled water. So here the question is, how does waterborne diseases spread? And the answer to this question is in this paragraph, that the excreta of the infected person mixes with the drinking water, and from this drinking water the disease is then spread. And how would we prevent such diseases? Prevent waterborne diseases by drinking clean boiled water, boiled or clean water. Next means we see through sexual contact. Now the sexual act is one of the closest physical contact between two people can have with each other. Not surprisingly, there are microbial infections such as syphilis and AIDS that are transmitted by sexual contact. So if I were to ask you, give example of sexually transmitted diseases, and they're called STDs. STDs means sexually transmitted diseases. Example of these are syphilis and AIDS. These diseases are transmitted. One of the means of transmission is sexual contact from one partner to the other. However, such sexually transmitted diseases are not spread by casual physical contact, just by shaking hands or hugging the person. These diseases do not spread. Casual contact means handshakes, hugs, or sports like wrestling or any other way in which we touch each other socially. Other than the sexual contact, AIDS causing HIV can also spread through blood-to-blood contact, that is to blood transfusion. Blood taken from an infected person, if it is injected into a healthy person, that the AIDS is transmitted with an infected person, or from an infected mother to a baby during pregnancy or through breastfeeding. So here we see, give the causes of AIDS or the transmission of AIDS. First is blood-to-blood transmission with infected person, sexual contact with infected person, mother to child during pregnancy or breastfeeding. So these are the ways by which AIDS could be transmitted. Another is, how can AIDS be prevented? Screening blood before transfusion. Before you take blood, there's blood transfusion. It's important that the blood is screened and seen that there is no AIDS virus. Treating pregnant mothers suffering from AIDS, using condoms during sexual act, and taking preventive measures like during surgery and in barbers. In surgery, whatever instruments are used have to be sterilized. Even in the case of barbers, you must make sure that you do not use a razor, a common razor. It's best to take your own razor when you go to the barbers, so that there's no transmission of these diseases like AIDS. What does AIDS stand for? So AIDS means acquired. Immune. So this is what AIDS stands for. It is acquired immune deficiency syndrome, and the virus that causes it is called HIV. So in this slide we learned about waterborne diseases, how they are caused, like cholera. Then we learned about AIDS, what causes AIDS, what are the modes of transmission of AIDS, usually from blood to blood or any other body fluids, by sexual contact, mother to child during pregnancy. Then we also learned how AIDS can be prevented. Here we will learn about vectors and another method by which diseases are spread. We live in an environment that is full of many other creatures apart from us. It is inevitable that many diseases will be transmitted by other animals. These animals carry infecting agents from sick person to another potential host. These animals are thus intermediaries and are called vectors. So vectors are organisms or animals that carry in the microbes from one organism to another. Like here, what are vectors? Vectors are animals that carry the infecting agent or the disease causing germ from a sick person to a potential host. Example, mosquito. Mosquito, why does it cause malaria? Because it carries the malaria pathogen from an infected person to a healthy person. So these are called vectors. Again I repeat, vectors are infecting agents, are animals that carry the agents, that carry the germ from one person to the other. Another interesting fact we are going to learn that it's only the female mosquitoes that feed on blood, not the male mosquitoes. We'll read about this. The commonest vectors we all know are mosquitoes. It's a very common vector. In many species of mosquitoes, the female need highly nutritious food in the form of blood in order to be able to lay mature eggs. It's a female that lays eggs, and because it lays eggs, it requires a good diet, a nutritious diet, and hence it feeds on blood, because blood is a very nutritious diet. Mosquitoes feed on warm-blooded animals, including us. In this way, they transfer diseases from one person to the other. So why do female mosquitoes feed on blood? Because it's a female mosquito that lays eggs, and in order to lay so many eggs that it lays, it requires a good diet, and hence it feeds on blood, on warm-blooded animals. And as it feeds on blood, it then transmits the pathogen or the microbe from one infected person to another healthy person. Here's a summary of how the disease from an infected person goes on to a healthy person. Different ways. One is direct contact, like handshake or sexual contact. Another is by air, by the water droplets when we cough and sneeze. Another way is by indirect contact, like water, food, okay, by food also, by clothing. Another by vectors, like mosquitoes, like a rabid animal. These are all vectors. They carry the infecting agents from from an infected person to a healthy person. Let's fill in the chart first. We have the airborne disease. Disease is spread through air, and the examples of this is common cold, tuberculosis. These are all spread by air. Then we have the waterborne diseases, which are spread by water. Example, cholera. We have typhoid, diarrhea. Then we have the STDs, sexually transmitting disease, which are examples are like AIDS and syphilis. And we have the vector-borne, which are carried like by mosquitoes, by rabid dogs. So you can say rabies, which is carried by a rabid dog, malaria. These are all vector-borne diseases. The next topic we do is organ-specific and tissue-specific manifestations. Before I read the text, let us go through something that we are very familiar with. We know the disease tuberculosis. Tuberculosis is an airborne disease. We breathe the unhealthy air through the nose. The tuberculosis microbe then settles into the lungs. And once it settles to the lungs, the symptoms of tuberculosis is cough and breathlessness because it has affected the lungs. Then we can have another example, say jaundice. It enters through the food, to the mouth, through the food and water. So the point of entry is the mouth. It affects the liver. Then we have AIDS. AIDS enters the body through sexual organs or through blood, and it affects the immune system or the lymph nodes. And hence we are unable to fight infections. You know, the immune system is a system that helps us to fight infections. And when our immune system is infected or inefficient, we are unable to fight infection. Then we have malaria. Malaria, it comes to the mosquito bite, it enters through our blood. Then the microbe will enter into the liver and cause jaundice. And then we have the Japanese encephalitis. It's also called the brain fever. It is also come to the mosquito. It affects the brain. It causes headache, vomiting, fits and unconsciousness. So for these different diseases, we have seen the point of entry, we have seen the target organ, and then we have seen the symptoms. Now there's one thing we need to notice here. The point of entry is sometimes associated with the target organ. If the nose is a point of entry, your target organ could be the lungs, because from the nose the air now enters into the lungs. If mouth is your point of entry, your liver could be the target organs because it is a part of the digestive system. But look up at AIDS. The point of entry is the sexual organs, but the target organ is the immune system. There is no connection between point of entry and target organ. Look at the Japanese encephalitis. The point of entry is the blood. It enters through the blood, but it affects the brain. There is no connection between point of entry and the target organ. So in some disease, there is a connection between the point of entry and the target organ. In some, there is no connection between point of entry and the target organ. Another point we are going to see in this slide is, if the lungs is affected, you know the symptom has to be cough and breathlessness. If your immune system is affected, what is the function of the immune system? To fight infections. So you are unable to fight infections. If the liver is infected, you get jaundice. If your brain is infected, you get a headache or unconsciousness. So this target organ is very closely related with the symptoms. So depending on the symptoms, you can know what is your target organs. If your symptom is cough and breathlessness, you will know your target organ is the lung. If it is a headache, vomiting or unconsciousness, you know your target organ is the brain. Now with this in mind, let's read the text. The disease causing microbes, they enter the body through different means. What are the different means? They could enter the body through the nose, they could enter through the mouth, they could enter through the blood like the mosquito bite. So they could enter the body in different ways. Where do they go then? The body is very large when compared to the microbes. So there are many possible organs or tissues where they could go. So do all the microbes go to the same tissue or organ? What would be your answer? No. Some would go to the lungs, some after entry would go into the liver, some would take the target organ as the brain. So although the microbes enter your body, they will reside in different organs. So different species of microbes seem to have evolved to home in on different parts of the body. So different microbes, they'll affect different parts of the body. This selection is connected to their point of entry. If they enter from the air via nose, they are likely to go to the lungs, like you saw in tuberculosis. When they enter through the nose, they go to the lungs. This is seen in bacteria causing tuberculosis. If they enter through the mouth, they stay in the gut lining like in the typhoid. We have not put it here, we could write here again typhoid. The point of entry is the mouth and it infects the gut or the intestines. And hence you get pain, you get loose motions. So typhoid causing bacteria enters to the mouth and it affects the gut. They go to the liver like viruses that cause jaundice. So liver is a target organ for jaundice. It is caused by the virus. So in the first here we saw that the point of entry was very much connected to the target organ. There was a relationship between point of entry and the target organ. Now next we will see how there is not much of a relationship between point of entry and the target organ. An infection like AIDS that comes into the body via the sexual organs will spread to the lymph nodes. So for AIDS, the target organs are the lymph nodes all over the body. Next is the malaria causing microbes. Entering to the mosquito bite will go to the liver and then to the red blood cells. Then we have the Japanese encephalitis or the brain fever will similarly enter through the mosquito bite, but it goes to infect the brain. So here there is no much relationship between the target organ and the point of entry. We'll now see how the symptoms depend on the target organs. The signs and symptoms of disease will depend on the tissue or organ which the microbe attacks. If the lungs are the target organs, then the symptoms will be cough and breathlessness. If the liver is a target organ, then it will be jaundice. If brain is the target organ, you will have headaches, vomiting, fits or unconsciousness. We can imagine what the symptoms and signs of an infection will be if we know the target tissue or the organ and the function that it carries out in the tissue or the organ. So if your stomach, like in the typhoid, if the gut or the intestines is infected, you'll probably get loose motion, pain in the stomach, because the microbe must have targeted the digestive system. In this slide, we will learn about inflammation. What is inflammation? Give its local and general effect. The minute a microbe enters a body, the body gets alerted. Here the immune system becomes very active. And when this immune system becomes very active, it produces a lot of cells. It recruits or makes a lot of cells. Hence, this process is called inflammation. If your hand is hurt, you will find that area around gets swollen up. And this swelling is an indication of inflammation. The body recruits, the body makes a lot of cells in order to fight the microbe, and this swelling is called inflammation. So an active immune system recruits many cells to the affected tissue to kill off the disease causing microbes. This recruitment process is called inflammation. So here we got the answer, what is inflammation. Next is give its local and general effect. As a part of this, there is local effects such as swelling and pain, and a general effect such as fever. So once we have an inflammation, we have a fever which is all over the body, so it's a general effect, but in that area we will get a swelling and pain. If we have like jaundice, our liver will have swelling and pain in the liver region because the liver is infected. If we have like typhoid, we will find pain in our stomach because the digestive system is infected. So we have the local effect, which is swelling and pain, and the general effect is fever. In the next, we will learn how does the infection of AIDS lead to death of a person. In a day, we breathe in, we take in a lot of microbes. A lot of microbes enter our body through maybe food, air, or we touch. So we have these microbes. But we do not fall sick every day because the immune system fights these microbes. So although microbes are entering our body every day, the immune system fights these microbes and we do not fall sick. But what would happen if the immune system is affected? If the immune system becomes weak, then we cannot fight these microbes, which means we'll fall sick so often. Even just a small cold, which the body, a common cold, which the body could fight so easily, now since the immune system is unable to work, this common cold then becomes into a pneumonia, resulting maybe in the death of the person. Another example could be if we have just a small food poisoning or an infection in the stomach, which the body fights on its own. But since the immune system is weak, this could turn into great blood loss and even death. This happens in AIDS. In AIDS, the immune system is infected. The immune system becomes weak, and hence person cannot fight even the smallest of infection, and it can lead to death. Even the smallest of infection, like a small cold or a little diarrhea, can lead to the death of the person because the body is unable to fight this infection. So we now read about it. In some cases, the tissue specificity of the infection leads to a very general seeming effect. Example, AIDS. AIDS infection, the virus goes to the immune system and damages its function. Thus, many of the effects of AIDS are because the body can no longer fight off the many minor infections that we face every day. Instead, a very small cold can become pneumonia. A minor gut infection can produce major diarrhea with blood loss. Ultimately, it is these other infections that kill the person from suffering from AIDS. So basically in AIDS, in HIV, which causes the virus, AIDS, what AIDS does, it affects or it weakens our immune system. And because it weakens our immune system, we cannot fight infections. Even small infections, which the body usually fights on its own. And because it cannot fight these infections, it can lead to death. Like a small common cold, here they've given a common cold can lead to a pneumonia. A minor gut infection can lead to diarrhea with blood loss. In this slide, we will learn about the factors, on what factors the severity of the disease manifestation depends. You know, when a person falls sick, some of them may get a very severe symptoms, but some may just not get the symptoms at all. Why is this the difference? Why is it some people get severe symptoms, some get less symptoms? Now that is all depends on number of organisms that enter your body. Like if you see here, if the number of organisms entering the body is very small, the manifestation or the symptoms will be less, because less virus or less bacteria have entered your body, the body finds it easier to fight this infection. But if the number of organisms entering is large, the manifestation is severe, because large number of organisms have entered your body. The immune system will find it more difficult to fight because the numbers are large. It also depends on the strength of your immune system. If you have a strong immune system, there is less manifestation. Strong immune system means you can fight a disease very well. A strong immune system will fight the disease. You will not get symptoms. Like in COVID, you see some of them don't even get the symptoms because they have a strong immune system. However, a weak immune system will have severe manifestation. If your immune system is weak, the fever is very high, the symptoms are very high, the breathlessness is very high, because your body is unable to fight the disease due to a weak immune system. So this is what we are going to read. It is important to remember that the severity of the disease manifestation depends on the number of microbes in the body. If the number of microbes is very small, the disease manifestation may be minor or even unnoticed. But if the number of the same microbe is large, the disease can be severe enough to be life-threatening. The immune system is also a major factor that determines the number of microbes surviving in the body. And that we already have seen. Strong immune system, less manifestation. Weak immune system, severe manifestation. Principles of treatment. Let us take an example of typhoid. Now, if you are infected with a typhoid, with the disease of typhoid. Now, why have you got typhoid? Because there is a microbe or the bacteria that has entered your body. So when you're treating for typhoid, you need to kill this bacteria. So you need a medicine to kill the bacteria. So one medicine has to be given to you to kill the bacteria. But along with the typhoid, you get very high fever. These are the symptoms. You get pain in your stomach. You get loose motions. Now these symptoms should also be handled. So the doctor will give you another medicine for the symptoms, to control your symptoms. So every treatment has got two aspects. One is to kill the bacteria or the microbe, and the other one is to treat the symptoms. Now, if you only give the symptoms, suppose you have a disease and they only give you the medicines to treat the symptoms. They do not give you a medicine to kill the bacteria or the microbe. Then what will happen? The bacteria remains or the microbe remains there, right? The infecting agent stays in your body. And the symptoms will keep repeating because you haven't killed the infecting agents. So it is important to have two kinds of treatment. One is to kill the infecting agent, like we use antibiotics and other medicines to kill the infecting agent, but we also have to have medicines to stop the symptoms, because the symptoms are quite painful. You have high fever, you can't afford to have high fever because it affects the brain. You can't afford to have loose motions all the time because then your body will not get enough of food. So a treatment, there are two ways in treating an infectious disease. And what are the two ways? One is to kill the infection and the second to treat the symptom. So now we'll see what are the two ways in treating an infectious disease. One would be to reduce the effects of the disease, and the other to kill the cause of the disease. The first, we can provide treatment that will reduce the symptoms. So we provide treatment that will reduce the symptoms. The symptoms are usually because of inflammation. For example, we take medicines that bring down the fever to reduce pain or loose motion. So one is to reduce symptoms, and the other is to kill the infection or kill the microbe, infecting agent. We can take bed rest that we can conserve our energy. This will enable us to have more of it available to focus on healing. But this kind of symptom-directed treatment by itself will not make the infecting microbe go away, and the disease will not be cured. For this, we need to be able to kill off the microbe. So we need also to kill the microbe. So the next question is, why symptom-directed treatment is not sufficient? Because if we do not kill the microbe, the symptoms will reoccur. So we need to write this: if we do not kill the microbe, the symptoms will reoccur. So treatment is made up of two: reduce symptoms and kill the microbe. Now that we know we have to kill the microbe, how do we go about killing the microbes? Now we know microbes, just like us, have got life processes taking place in their body. All we need to do is block these life processes, and we do this with the help of medicines. So basically, what do medicines do? They block the life processes of the microbes, and this kills the microbes. Now, in order to give the right medicines to block the life processes, we have to learn about the life processes of the microbes, and only then can we use appropriate medicines. How do we kill microbes? One way is to use medicines that kill the microbes. We have seen earlier that microbes can be classified in different categories. They are the viruses, the bacteria, the fungi, and the protozoa. Each of these group organisms will have some essential biochemical life processes which is peculiar to that group and not shared with the others. These processes or pathways for synthesis of new substances or respiration. So in other words, microbes have got their life processes, they have got their biochemical reactions or biochemical processes, pathways taking place in their body. And now here, in order, what do the medicines do? They do nothing, but they just block the biochemical pathways. But now viruses have something interesting. Let's learn about viruses. Viruses have very few biochemical pathways. In fact, outside the body, they are unable to even grow. So what do viruses do? They enter into the host cell, like in the human cell, and they will take up the mechanism of the cell and reproduce. So take up the mechanisms of the cell and reproduce. Now the problem here is, now the biochemical pathways of the virus and the humans become common because the viruses are using the biochemical pathways of the humans to reproduce. So biochemical pathways of virus and humans or the host cell are the same. So if you're going to target or you're going to stop the pathways of the virus, you will also stop the pathways or target the pathways of the host cell because the pathways are the same. So if you try to stop the virus, you will also stop the host cell. So hence it is very difficult to make antiviral medicines, because the viruses share the pathways of the human cell. They use the pathways of the human cell for their reproduction. We'll read about this. These pathways will not be used by us. For example, our cells may make new substances by mechanisms different from that of the bacteria. We have to find a drug that blocks the bacterial synthesis pathway without affecting our own. This may be achieved by antibiotics, and we are all familiar with drugs that kill protozoa such as malaria parasite. So antibiotics, they block bacterial pathways. And these bacterial pathways are different from human pathways. So what do antibiotics do? They stop the bacterial pathways, but the human pathways carry on. So the antibiotics work. But viruses, antiviral medicines are difficult to make, because if you block the virus pathway, you also block the host, the human pathway, because their pathways are common. They have common or same pathways. The virus enters the cell and uses the pathways of the cell. Why making antiviral medicines is harder than making antibacterial medicines is that viruses have few biochemical mechanisms of their own. They enter our cells and use our machinery for their life processes. This means that there are relatively few virus-specific targets to aim at. Most of the targets are common. Most of the pathways are common. There are very few pathways that are different. Despite this limitation, there are now effective antiviral drugs that keep HIV infection under control. Next, we learn principles of prevention. Now, almost every disease has a treatment. So does it mean that we should not prevent diseases? We should be careless saying, okay, the disease has a treatment, so we can fall sick and get treated. Now, what would happen if we get a disease? There are 3 limitations to this approach to dealing with infectious disease. The first is that once someone has a disease, their body functions are damaged and may never recover completely. So we have to make sure we try to prevent disease, because if the body functions may never recover again. The second is treatment will take time, which means that someone suffering from a disease is likely to be bedridden for some time, even if we can give proper treatment. So till then he is unable to work, he is unable to do his duties. So we have to make sure that we prevent diseases. Third is that the person suffering from the infectious disease can serve as a source from where the infection may spread to other people. So you could be a source of spreading the disease. This leads to multiplication of other difficulties. It is because of such reason that prevention of a disease is better than cure. So the answer to this, give the limitations of treatment, or why is prevention better than cure, you've got to write these 3 points. The first point is that your body functions could get affected badly for a long time. Second, you will be bedridden for some time and unable to do your work. And the third is you could be a source of infection to others. So hence we should try to prevent the disease. We'll now go ahead and see how do we prevent diseases. There are 2 ways. We have the general way, and then we have the specific way to prevent diseases. First we go into the general way. To understand the general way, we know first thing is to prevent exposure. The general way of preventing infection mostly to relate of preventing exposure. We should not get close to the microbe. For example, in airborne microbes, we can prevent exposure by providing living conditions that are not overcrowded. So if we have living conditions that are not overcrowded, we can prevent airborne diseases. When it comes to waterborne microbes, we can prevent exposure by providing safe drinking water. This can be done by treating water to kill any microbial contamination. And for vector-borne infections, we can provide clean environment, like allow mosquito breeding, not allow mosquito breeding. So public hygiene is one of the basic key for prevention of diseases. So all this comes under preventing exposure. This whole paragraph would come under preventing exposure. We have seen for in airborne, how do we prevent exposure? We have seen for waterborne, how we prevent exposure, and for vector-borne. Then the next general way is our immune system. We need to build our immune system very strong, hence we can fight almost any disease. So immune system is normally fighting our microbes. We have cells that are specialized in killing infecting microbes. Especially they are the white blood cells, and even our lymphatic system helps in fighting infections. These cells go into action each time infecting microbes enter the body. If they are successful, we do not come down with any disease. The immune system manages to kill off the infections long before it assumes major proportions. As we noted earlier, if the number of infecting microbes is controlled, the manifestation of the disease will be minor. In other words, becoming exposed to an infectious microbe does not necessarily mean developing a noticeable disease. Here they are trying to say that immune system plays a very important role in fighting the microbe. So although in our body we take in a lot of microbes every day, we do not fall sick every day because the immune system fights these microbes. If the immune system is unable to fight this microbe, then we fall sick. So how do we take care of our immune system? How do we build a strong immune system? And this is done proper sufficient nourishment and food. So there are other also points, not only food, but I think proper food, you need proper rest, exercise. So all these points build up a strong immune system. So the general ways are two. Like here, how can we prevent diseases? One is a general way, is preventing exposure, that we have already seen for airborne diseases, waterborne diseases, vector-borne diseases. And another way is strengthening our immune system. And how do we strengthen our immune system? Having a balanced nutritious diet, sufficient rest, and exercise. Then we have specific methods, and specific methods is immunization by taking a proper vaccine. Like to prevent polio, you take a polio vaccine. Now to prevent COVID, they are now preparing a vaccine for COVID. So that is a specific method of trying to prevent the disease by taking a vaccine. So this is important. How can we prevent diseases? We have the general way and the specific methods. We'll now see how vaccines work. Most of the vaccines work under this principle. The person is first injected, maybe injected or introduced with a weakened microbe, a very weak microbe. Like for a polio vaccine, they will put a weak polio microbe into the body of the person. Now, when this weak microbes enters into the person's body, the immune system gets activated. Now, this microbe is weak, hence it cannot grow very rapidly. It does not invade the body. The body has enough time to fight it because it is a weak microbe. So the immune system gets activated. The immune system creates antibodies. It fights this microbe and creates a memory. It remembers how to fight this microbe. A memory for fighting is created or is developed for this proper microbe. So the next time when in the person's body a germ enters, like a polio germ, the germ of the disease enters, the body already knows how to fight it because the body already has the antibodies created by the vaccine, and it also has a memory of how to fight the disease. So then the body then fights the disease. It doesn't take time for the body to fight the disease because the vaccine has already created these antibodies and the memory. This is created by the vaccine. This is how vaccines work. Let me go to that again. So we said when a person is injected with a vaccine is actually a weak germ. The immune system gets activated, and when the immune gets activated, it creates antibodies and it fights the microbe. It easily fights the microbe because the microbe is weak. A memory is developed in the body. The body remembers how to fight this microbe. So when the person is infected with the germ of the disease, the antibody is already present. The memory is already developed by the vaccine. So the body finds it very difficult to fight the infection. This vaccination was first invented by Edward Jenner. He noticed that when people suffering from smallpox who suffered from smallpox and survived it, it was very difficult to survive smallpox, but those who survived the smallpox never got smallpox again. Now, why did this happen? Because when they suffered from smallpox and they survived it, means the body had already developed antibodies. The immune system had developed antibodies and also developed a memory to fight the smallpox. So again, when the smallpox vaccine would enter such people, the smallpox virus would enter such people, they did not fall sick. Why? Because they already had these antibodies in memory. They had survived the smallpox. The same thing happens for chickenpox. Once you get chickenpox, you never get it again. Because when a person suffers from chickenpox, after he has survived, you always survive from chickenpox. It's very rare that it is fatal. So after the chickenpox is over, you have developed antibodies in your body. Your body has developed memory for this virus. So when again, if you get chickenpox, if such person gets chickenpox again, the body will fight it. Why will the body fight? Because the body already has these antibodies. It already knows how to fight this chickenpox. So the immune system immediately gets into action and fights the chickenpox. So once you have chickenpox, you have antibodies in your body and you will never get chickenpox again. This is what Edward Jenner first noticed. He noticed that people that had a disease called cowpox, it was a disease similar to smallpox. These people, they never got smallpox. Now, why never got smallpox? Because once they got this cowpox, they would have developed antibody and a memory for this disease. So they would never get smallpox, because the minute the smallpox virus entered, the antibodies, the immune system was ready to fight it. We'll now read about this. These days there is no smallpox anywhere in the world. It has been eradicated. But as recently as 100 years ago, the smallpox epidemics were not at all uncommon. In such an epidemic, people used to be afraid of coming near someone suffering from the disease, since they were afraid of catching the disease. There was one group of people who did not have this fear. These people would provide nursing care for the victims of smallpox. These people, the special group, were not afraid of the smallpox. Why? This was a group of people who had smallpox earlier. Now, if they already had smallpox, means they had the antibodies of smallpox. So they were not afraid of coming in contact with smallpox again. Their body had already learned how to fight the smallpox and survive it, although with a lot of scarring. In other words, if you had smallpox, there was no chance of suffering from it again. So having the disease once was a means of preventing subsequent attacks of the same disease. And you know why? Because if you had the disease, you would have developed the antibodies and the immune system would have developed the memory for that disease. This happens because when the immune system first sees an infectious microbe, it responds against it and then remembers it specifically. It develops a memory. So the next time that particular microbe or its close relatives enter the body, the immune system responds with even greater vigor, because it can identify the microbe very easily. So it fights with greater vigor. This eliminates the infection even more quickly than the first time around. This is the basis of the principle of immunization. So you've got to learn this as principle of immunization. Many such vaccines are now available for preventing a whole range of infectious diseases and provide a specific means of prevention. There are vaccines for diphtheria, whooping cough, measles, polio, and many others. So you've got to learn this. These are the vaccines that are available now. These form the public program of childhood immunization for preventing infectious disease. Here's another point we need to know. Some hepatitis virus which cause jaundice are transmitted through water. There is a vaccine for one of them, hepatitis A, in the market. But majority of the children in many parts of India are already immune to hepatitis A by the time they're 5 years old. Why? Because they are already exposed to the virus through the water. And because they're exposed to the virus, they have already developed the antibodies and a memory for that virus. so they don't need a vaccine. Here's a little paragraph that we missed. So as a general principle, we can fool the immune system into developing a memory for a particular infection by putting something that mimics the microbe, and that is a vaccine. We inject the vaccine into the person either by drops like in the polio, or inject it, and we mimic the microbe. We send it a weakened microbe, so the body then is awakened, the immune system gets active and produces the antibodies. We want to vaccinate against into the body. This does not actually cause the disease, but this would prevent any subsequent exposure to the infecting microbe from turning into the actual disease. What is vaccination? How does it work? Vaccination is a way to prevent or kill weak microbes that are introduced in the body to develop antibodies and thus prevent occurrence of the disease during the actual entry of the disease causing microbes. Why did people that suffer from cowpox did not get smallpox? Because when they suffered from cowpox, they developed antibodies and a memory to fight the disease. So when the smallpox came in, the immune system now fought with more vigor because it recognized the virus very easily. What is immunization? Is to develop immunity for a disease by vaccination. Name some diseases that can be prevented by vaccines, like polio, we saw, whooping cough, we have measles, which can be prevented by vaccines.